Hi guys! Have you ever wondered why do we need to have urine analysis? So, urine analysis is a routine test that reports the physical and chemical properties of urine. It is used mainly to assess the health of the kidneys and urinary system, but it can also reveal problems in other organ systems. There are three main ways to collect urine in cats and dogs. First is cystocentesis. In cystocentesis, a sterile needle and syringe are used to collect urine from the bladder. The needle is passed through the abdominal wall into a full bladder and urine is withdrawn directly into the sterile syringe. The advantage of cystocentesis is that the urine is not contaminated by miscellaneous debris from the lower urinary passage. This type of sample is ideal for assessing the bladder and kidneys and for detecting bacterial infection. However, the disadvantage of cystocentesis are that the method is slightly more invasive than other methods and it is difficult to do in patients that are uncooperative. Next is catheterization. In catheterization, a very narrow sterile catheter is passed up the lower urinary passage, called the urethra, into the bladder. A sterile syringe is attached to the catheter and urine is withdrawn from the bladder into the syringe. The technique is less invasive than cystocentesis and is a good option when a voluntary sample is not available, especially in a male dog. However, catheterization causes mild irritation to the urethra and may carry bacteria from the urethra into the bladder. Lastly, in midstream free flow, urine is voided voluntarily by PET in the usual way and a sample is collected into a sterile container as the PET urinates. You should select a leak-proof container. Here are the steps on how is urine collected in midstream free flow. How is urine collected? So, first thing to do is determine the time when to get the sample. A urine sample collected first thing in the morning is usually the most accurate. You can also try collecting a sample after a meal or on your normal walk when there are interesting smells to sniff and your dog wants to mark its territory. The components of urine analysis includes urine-specific gravity, urine pH, chemical composition, in which it includes proteinuria, ketonuria, glucosuria, and bilirubinemia. Next is urine sedimentation, cells and solid materials, and lastly, miscellaneous. In dogs and cats, any urine-specific gravity may be normal because the kidneys maintain water balance. Urine-specific gravity will vary with water and solute intake and body needs. However, in dehydrated dogs and cats, urine should be concentrated to a specific gravity greater than 1.035. Urine-specific gravity is also greatly affected by administration of diuretics, corticosteroids, radiographic contrast agents, and fluid therapy. These treatments reduce the usefulness of specific gravity as an indicator of renal function. Normal dogs usually concentrate to greater than 1.45 when challenged with mild dehydration or 5% dehydration. A specific gravity that is greater than 1.30 to 1.45 in dogs and cats with no internal medical problems and with normal BUN serum creatinine, and hydration, urine-specific gravity in this range is considered normal. However, with dehydration or azotemia, values in this range are abnormal in cats. And in dogs, with dehydration, azotemia, or both, this range is more difficult to interpret and may indicate normal concentrating ability or a mild loss of concentrating ability. A urine-specific gravity that is 1.13 to 1.29, in this range, it indicates some ability to concentrate urine. Values in this range may be normal if no stimulus of urine concentration exists. However, values in this range are abnormal if the animal is dehydrated or azotemic due to a pre-renal or renal insult. A specific gravity that is 1.008 to 1.012 in this range is isostenuric, meaning that no urine concentration has occurred, in which its specific gravity equal to that of plasma. This value may be normal if no stimulus to concentrate is present, and if a stimulus to concentrate such as dehydration or azotemia of pre-renal or renal origin is present, values in this range are definitely abnormal. A urine-specific gravity that is less than 1.008 in this range are hypostenuric. Values in this range can be normal if the animal has a need to excrete extra water, but they are abnormal in animals with a need to retain water due to dehydration. Urine-specific gravities in this range may be produced by a primary polydipsia, lack of ADH, or inability of the kidney to respond to ADH. Urine-specific gravities in this range usually warrant further diagnostic testing because they are associated with profound polyuria and polydipsia. A CBC, complete blood chemistry profile, and complete urine analysis are indicated. If these are normal, water deprivation and ADH response test should be performed. Urine pH is a measure of how acidic or alkaline the urine is. The pH can change with diet but can also signal the presence of infection or metabolic disease. A pH of 8, 9, and 10 are considered as alkaline pH. And if the pH is 7.0, it is considered as neutral. If the pH is markedly acidic, that is less than 6.0, one might suspect a systemic tendency to acidemia. An acidic urine pH does not rule out urinary tract infection, as most urinary tract pathogens do not affect urine pH in vivo. Urine pH that is greater than 7.0 is considered as alkaline, and it is produced for several hours postprandially. The most common disease condition that produces constantly alkaline urine is urinary tract infection with Staphylococcus or Proteus. These organisms produce the enzyme urease, which degrades urea to ammonia, causing alkalinity. Consistently alkaline urine in the dog and cat can result in development of struvite uroliths. Another cause of persistently alkaline urine is renal tubular acidosis. In this condition, metabolic acidemia results from the inability of the kidney to reabsorb bicarbonate from proximal renal tubular acidosis type 1 or secrete hydrogen ions, distal renal tubular acidosis type 2.